But first, though, 10 police officers were injured and 14 people had been arrested after a Black Lives Matter protest in London, which had been peaceful for most of the day. Now, the anti-racism march followed the death of George Floyd in Minneapolis after a police officer knelt on his neck, which has sparked almost 2 weeks of demonstrations across the United States. Well, we can go now to central London and talk to the Health Secretary, Matt Hancock. Thank you for being on the programme this morning. I just want to start with those protests because it does feel like the death of George Floyd has sparked a lot of soul-searching in the United Kingdom as well. Do you think that this country is racist?
I don't, but I do think that there's injustice that needs to be tackled. And I've spent my political life fighting for equality and for diversity. And I think that, I think we're one of the most tolerant and open societies in the world, but there's always more that can and must be done, especially to empower people so that they can achieve their potential. It's at the core of my political beliefs, and I think that it's incredibly important. So I think that the substance of what's being said and the arguments made by those who are marching, I think there's a lot to it. I think, thankfully, this is all based in response to events in America rather than here. But we also must continue the drive here for tolerance and genuine equality of opportunity.
It's interesting you say that more should be done. It's chiming really with what Sajid Javid, who until a few months ago was sitting around the cabinet table with you, has said in the Sunday Times, saying that ethnic minorities in Britain are still the victims of racial injustice and substantial disparities in opportunity. The government can and must do more to address racial inequalities in our society. So, specifically, what should the government do?
Well, I think that it's right across the board that actions needed. It's a core part of the levelling up agenda that this government is committed to. It, of course, starts with education and job opportunities. So it's right across the board. In my area, in health, we see health disparities as well that need to be addressed. And we see disparities in, for instance, even before COVID, disparities in life expectancy. And then this disease has cruelly demonstrated that there's more of an impact on people from black and minority ethnic backgrounds as well. So I think it's something that is important that we all drive forward on, because a truly fair society is one where there's equality of opportunity, and that means giving opportunities. At the absolute core of my political beliefs is that every single person has a contribution to make and something to offer, and it's the responsibility of the state to help them to make the most of that contribution.
Just to pick up on what you were saying there about how black and minority ethnic communities are at greater risk of dying from COVID-19 than white people, because this week Public Health England published that report, but it didn't actually include any recommendations for action. Were those recommendations held back?
No, there's a whole series of changes that we've already made. And the next step, which we're taking forward across government and being led by Kemi Badenoch, the Minister for Equalities, is to make sure we get to the bottom of the question, why are those disparities there, and what further steps can we take? For instance, some of the explanation may be down to a higher likelihood of people from black and minority ethnic backgrounds being in occupations where the occupation is more at risk. For instance, frontline occupations, both in transport and in the health service and social care, and putting more protection in place for people in those occupations will in turn help reduce these disparities. So that's the work that we're now taking forward, following on from the report that you mentioned.
We've been talking about the importance of doing more. How many black people are in cabinet?
I'm so sorry, I didn't catch that question, Sophie.
How many black people are in the current cabinet?
There's a whole series of people from a black and minority ethnic background. The Chancellor of the Exchequer, the Home Secretary, to name but two.
I'm just talking about blacks. Sorry, I'm talking about black people specifically because I do think it's quite important not to lump everyone from non-white backgrounds together, because obviously Asian people, for example, face prejudice too, but it might be a different prejudice to that faced by black people. 62%, for example, of GCSE pupils from Indian backgrounds got a strong pass in English and maths, 27% to black Caribbean. You're 3 times as likely to be stopped and searched if you're black than if you're Asian. So that's why I was specifically asking about how many black people there are in the current cabinet.
The 2 cabinets I've sat in with Boris Johnson as Prime Minister are the 2 most diverse cabinets I've ever sat in. Right at the top of government, including in the great offices of state, people from black and minority ethnic backgrounds. Kwasi Kwarteng was sitting around the cabinet table with me. Actually, I think that Boris Johnson has got a very good record on this. And it brings people in and listens to a diversity of views. And it's diversity of thought that's the really important thing when you're taking those big decisions around the cabinet table.
So actually, are you saying then that people from black backgrounds shouldn't really worry that there isn't a single person from a black background at the current cabinet table because you have diversity of thought?
No, what I'm saying is that the cabinets, the governments that Boris Johnson leads are some of the most diverse in the history of this country. I just was talking about the Minister for Equalities, Kemi Badenoch, who is taking forward this work. You know, she's joined the government recently and been brought in by Boris Johnson. And it's that diversity of thought is absolutely critical and incredibly important for making good decisions. But there's a broader point, which is making sure we address this whole issue and make sure that we increase the chances and increase the opportunities for everybody. And in doing that for everybody, so of course we must do it for those who are the most disadvantaged, or whatever the colour of their skin. And it happens that we've got to make sure, in particular, that this agenda leads to closing gaps in inequalities, including inequalities between people of different ethnic backgrounds. So, it is a broad agenda that the government is pursuing and pushing very, very hard. What I would say is the way to achieve this is to make the argument, and I support that argument very strongly, but please don't gather in groups of more than 6 people, because there is also a pandemic that we must address and control. And so we've got to make the argument, we've got to make further progress on top of the significant progress that has been made in recent years, but we've got to do it in a way that's safe and controls the virus.
On that note, talking about not gathering in groups of more than 6, of course, you can have deep sympathy with the aims, the protests that we've seen this week, but also have concerns about the number of people gathering in a pandemic. Do you think that seeing the number of people that we did gathering in groups means that an increase in cases of COVID-19 is now more likely?
Well, it's undoubtedly a risk. It's undoubtedly a risk. So, I support very strongly the argument that is being made by those who are protesting for more equality and against discrimination. But the virus itself doesn't discriminate. And gathering in large groups is temporarily against the rules precisely because it increases the risk of the spread of this virus. So I would urge people to make their argument, and I will support you in making that argument. But please don't spread this virus, which has already done so much damage and which we're starting to get under control.
I'm keen to move on now to the government's response to coronavirus and COVID-19, because the Sunday Times is reporting this morning that Boris Johnson has ordered ministers to start lifting the lockdown more quickly in order to save up to 3.5 million jobs. And those new measures signed off at a meeting with the Chancellor on Friday night. Is that correct?
We've got a clear plan. And we're working through that plan. That plan does involve the reopening, subject to ensuring that it's safe, the reopening of the remaining retail that isn't currently open in a week's time, and I know you're addressing that later on this on the programme, and we're working through that plan. The plan and the strategy hasn't changed. It's a matter of working through it, and of course, always doing that with safety front of mind, cautiously progressing. Now, we are making significant progress against this virus. We protected the NHS, and we've bent the curve down so there's fewer and fewer new cases, and that is a good thing. But we've got to get that number of new cases right down so that it is safe, and then we've got to hold it down, both through being very cautious on the national lockdown measures, and also, of course, introducing more local action to be able to deal with local flare-ups when we find them.
You are emphasising how important it is to have a safety-first approach to it. You've always said, along with the Prime Minister, that you'll be guided by the science. And the R rate, the rate of infection, is something that you've talked about a lot, the need to keep that below 1. But a study out this week, a model from Cambridge University and Public Health England, has said that R has risen in all regions and it's above 1 in some regions, and that these increases may result in the decline in the national death rate being arrested by mid-June. If that is the case, then why are you pushing ahead with easing the lockdown? Yeah,
well, the straightforward answer to that is that we take into account a number of models, just over. There are several models that we take into account through SAGE. SAGE brings that advice together. You mentioned one model, and the same day that was published, a more direct measurement through the Office of National Statistics showed that the number of new cases per day had fallen from around 8,000 to around 5,500, which obviously is a very good progress.
We're talking about R because you were the ones who put that at the heart of your response.
Yeah. Right. So I was just going to come on to that, absolutely. So my point is, what you shouldn't do is look at one particular report and say that is the answer. You should look right across the board at all of the different measures that are taken into account. And the scientists bring this together through SAGE, and SAGE's overall view is that R is between 0.7 and 0.9, and that it is below 1 in each region of the country. But you're right, Sophie, that there are some areas where we think R is a bit higher than elsewhere, including the northwest of England. And we've got to make sure that where there are localised outbreaks, we absolutely tackle those, working with local directors of public health. And so this is an important part of how we tackle the next phase, which is where there's a local outbreak, we take local action. I spoke to Andy Burnham, for instance, the Mayor of Greater Manchester, because of the increased prevalence of problems relative to the rest of the country in the northwest. But overall, R remains below 1, between 0.7 and 0.9 by the best estimate of SAGE, including in all parts of the country. So we are able to proceed. But again, I come back to this, and I will keep coming back to this. We proceed with caution, and we proceed with safety first, making sure that as those shops do reopen, and that it is safe to do so, and they do so in a way that's compliant with the COVID-safe working guidelines.
I take your point that you can't just pick out one study. You have to look at models across the board. So where are we currently on the COVID alert system that your government introduced?
Well, we're currently on level 4 and moving towards level 3, and I look forward to an update on that as and when we get more and more data in.
Because the reason I'm asking is that when you brought in the COVID alert system, the government showed some slides at the daily press conference, and those slides clearly stated that an easing of lockdown restrictions only begins at level 3. So I'm just a bit confused. Why is it that we are beginning the gradual relaxation of restrictions and social distancing measures while we're still at level 4?
Well, as you say, we're guided by the science throughout this. That's incredibly important. And the Chief Medical Officer, the Chief Scientific Advisor, who bring together all of that scientific advice, because, there's 100 voices on SAGE, and each of them makes their points to the best of their scientific ability and understanding, and then that's brought together by the Chief Medical Officer and the Chief Scientific Advisor. They advise us, and we as ministers, democratically elected, make the decisions. That's how it works. And the level is clearly moving from 4 to 3, and the reason for that is because we can see that the number of new infections is coming down. It's now a long way below where it was at the peak. It's below where it was, well, it's been coming down all the way through. Sadly, there are still people dying, but the number of people dying each day is also falling. The number of people admitted to hospital is falling. The number of people in hospital is falling. So we are winning the battle against this disease. And that allows us to release more of the restrictions, including putting in place this local action supported by the test and trace system. But we've got to be cautious in our approach to it, because the last thing anybody wants is for the virus to get going again and us have to go right back to square one.
You see, I'm just slightly confused as to why you'd introduce a COVID alert level system and then just not follow it. You know, we've been told time and time again that we're following the science, but the R rate doesn't seem to be coming down. It seems to be ticking up, if anything. The alert level hasn't come down from level 4 to level 3, but we're still pressing on with easing the lockdown. Now, I understand that there will be economic concerns as well, really genuine economic concerns too, but I just don't really understand why you wouldn't just admit that those concerns are coming into play as well, and you're not necessarily still following the science.
Well, because I'm not going to say that because that's not true, you see. The thing is, you have to take into account all considerations, not just pick on a couple. So, for instance, the point about R is that when R is below 1, the number of new infections continues to fall. R is about the rate of change of infections, not about the level. And so that's why keeping R below 1 is so important, because you don't want the virus to go out of control. But it also means that wherever R is below 1, that will keep the number of infections down and falling. So the assessment of R being below 1 is important. If R moves towards 1 but stays below 1, then the rate in which the number of new infections comes down will slow, but the number of new infections will continue to come down. You know, this difference between the level and the rate of change is absolutely critical to understanding how we control this virus. And the result of that is that the approach we're taking into account all of the different models, all of the epidemiology, and all of the scientific advice, which is so important for us to base our decisions on, is that we're taking a cautious approach. Now, people do ask me about the economy, but my view is that the worst thing for the economy would be a second spike. And so there isn't this trade-off that is, you know, much is made of in the media between the health and the economy. I care deeply about getting the economy going, and the best way to get the economy going is to ensure that we get the number of new infections right down. That's what matters for the future of the economy as well. So it's not it's easy to write stories about a trade-off. What really matters for this whole country is that we get the number of infections right down, we keep that R below 1, and then we can cautiously reopen some of the things that some of the things that make life worth living, whether that's on the economic side or indeed allowing people to meet in groups of up to 6. Or the announcement from the Community Secretary this morning that private prayer is now going to be allowed, which I think is an incredibly important and positive step for many, many people.
We are running out of time, but just quickly, of course, this quarantine is coming into place from tomorrow, where any arrivals in the UK will have to self-isolate for 2 weeks. Is that the end of the summer holiday abroad for this year, at least?
Well, we're bringing in the quarantine policy again because as the number of new infections comes down, so the proportion of infections that come from abroad increases simply because the number of new infections domestically is coming right down. I've said before, I really hope that people are going to be able to fly, to go on summer holiday, but we've got to take an approach that starts with caution. Of course we do.
OK, Matthew Hancock, thank you very much for being on the programme this morning. Thank you.